Gracias, Ciro, and it's very, very nice to join you today. I'm very much looking forward to this, to having this discussion, and I hope we can maybe keep our interventions to a minimum so we can have really more of a dialogue on this. And thank you to those who've put this together. I think from our perspective, this is almost like leapfrog learning. You know, we learned so much about pandemic preparedness and about pandemic response during the previous pandemic and dealing with H5N1 and other issues. A lot of that was applied in advance and during this pandemic, but not enough was applied, not enough was learned, not enough investment was made, and we've paid a heavy price for that. Now we've had this, pandemic of a respiratory virus. It happens to be a coronavirus, but it shows many of the same patterns, exposes many of the same limitations and weaknesses in our response systems. So whether we look at this as a coronavirus outbreak or a pandemic of a respiratory pathogen that can spread from person to person and affect the world in the way it has, I think we're at this moment now, and I think this is a difficult, Ciro, you and I working on this. Learning the lessons now for how we build better systems is tough to do when we're still in the middle of this fight. We have to balance what we can learn now to further contain and stop the spread of this disease and vaccinate and scale up our response to end this pandemic and end this as a public health tragedy and a tragedy for people. Can we learn the lessons we're learning in real time and applying in real time, and then what we can do to apply the lessons for the future? And when we look at this, I would look at this in four distinct phases. We've got the preparedness phase, or the phase before a pandemic, in which we build our systems, in which we identify risks and try and manage those risks and reduce those risks. Then we have the period of detection, the moment at which a disease crosses the animal-human species barrier, or whatever the trigger point is, what we do to detect, assess, investigate, and respond immediately to that event. The next is that early period of containment, that early period of scaling up our response in order to try and contain the public health crisis, either geographically or in terms of the people affected. And then there is that more longer term control and mitigation phase when we're really trying to reduce the damage the virus is doing, bring up population protection levels. And I think when we look at those four elements of a pandemic cycle, I think there are huge lessons to learn at every phase of that. There are lessons to learn in how our strategies for doing all of those things. There are lessons to learn on how we manage the financing of all of that. There are lessons to learn on how we manage data in each phase. There are lessons to learn on how we drive research and innovation around each phase. There are lessons to learn about how we engage communities in each phase. But what we do in each phase is quite different, but it is ultimately based on having an understanding of each and every one of those phases of the pandemic cycle, and then understanding what are the partnerships, what are the financing needed to do better the next time. And especially right now, what are the knowledge and learnings we need to do now to end this pandemic as soon as we can. So with those very brief introductory remarks, I'll pass back to you, sir.